CEN Written Exams Course. Question 1. A patient presents with an animal bite, likely a dog bite. The wound is deep and contaminated. The CEN should: Option A. Irrigate the wound and close it primarily. Option B. Irrigate, debride, and administer rabies prophylaxis. Option C. Administer antibiotics only. Option D. Apply a pressure dressing. The correct answer is option B. Irrigate, debride, and administer rabies prophylaxis. Animal bites, particularly from wild animals, require thorough irrigation, debridement, and rabies prophylaxis, post-exposure prophylaxis, PEP. Primary closure is generally not recommended to prevent infection. Antibiotics are indicated for high-risk wounds, e.g., deep, contaminated, or on the face. Tetanus prophylaxis is also indicated. Question 2. A patient presents with a wound that is dirty, deep, and contaminated. The CEN should: Option A. Irrigate and debride the wound. Option B. Close the wound primarily. Option C. Leave the wound open. Option D. Apply a pressure dressing. The correct answer is option A. Irrigate and debride the wound. Dirty wounds require extensive irrigation with normal saline to remove debris and bacteria. Debridement of devitalized tissue is essential to prevent infection. Primary closure may be delayed primary closure, to allow for drainage and monitoring. Pressure dressings are not the primary treatment. Tetanus prophylaxis is indicated. Question 3. A patient with heart failure presents with severe dyspnea, pink frothy sputum, and rales auscultated halfway up the lung fields. The CEN should anticipate which intervention? Option A. For normal saline bolus. Option B. For furosemide and nitroglycerin. Option C. For epinephrine. Option D. Immediate intubation. The correct answer is option B. For furosemide and nitroglycerin. This patient is in acute decompensated heart failure with pulmonary edema. Management includes diuresis, furosemide, and afterload reduction, nitroglycerin, to reduce preload and afterload. Oxygen and non-invasive positive pressure ventilation, BiPAP/CPAP, may also be used. Normal saline would worsen volume overload. Intubation may be needed if the patient fails non-invasive measures. Question 4. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50 mmHg? Option A. Atrial fibrillation with rapid ventricular response. Option B. Supraventricular tachycardia, SVT. Option C. Ventricular tachycardia with a pulse. Option D. Atrial flutter with 2:1 block. The correct answer is option C. Ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario. Question 5. A patient with a suspected overdose of opioids has a respiratory rate of 6 breaths/min. The CEN should: Option A. Administer naloxone 0.4 mg 4. Option B. Administer naloxone 2 mg 4. Option C. Administer naloxone 0.4 mg IM. Option D. Administer a naloxone drip. The correct answer is option A. Administer naloxone 0.4 mg 4. Naloxone is the opioid antagonist used to reverse respiratory depression in opioid overdose. The standard initial dose is 0.4 mg 4. If there is no response, the dose may be repeated. Naloxone can be given IM or intranasally if 4-access is not available. The CEN should start at 0.4 mg 4 to avoid precipitating severe withdrawal in opioid-dependent patients. Question 6. A patient with a suspected hemorrhagic fever, e.g., Ebola, should be managed with Option A. Strict contact and droplet precautions. Option B. Airborne precautions. Option C. Standard precautions. Option D. Enhanced contact and droplet precautions. The correct answer is option D. Enhanced contact and droplet precautions. Hemorrhagic fevers, Ebola, Marburg, Lassa, require a high level of isolation, enhanced contact and droplet precautions, including double gloves, impermeable gowns, face shields, and shoe covers. These patients should be in a single room with dedicated equipment. The CEN should follow the facility's protocol for high-consequence infectious diseases. Airborne precautions may also be used in some settings. Question 7. A patient with cardiac arrest has a rhythm of ventricular fibrillation, VF, on the monitor. The patient has received 2 defibrillation attempts and 1 dose of epinephrine. What is the next medication to administer? Option A. Amiodarone 300 mg 4 push. Option B. Lidocaine 100 mg 4 push. Option C. Magnesium sulfate 2 grams 4. Option D. Sodium bicarbonate 50 ml equivalent 4. The correct answer is option A. Amiodarone 300 mg 4 push. For shock refractory VF/pulseless VT, the ACLS algorithm recommends amiodarone 300 mg 4/IO push after the second shock. A second dose of 150 mg may be given for recurrent VF/VT. Lidocaine is a second-line alternative. Magnesium is for torsades de pointes. Sodium bicarbonate is not routinely recommended except in specific scenarios, hyperkalemia, tricyclic overdose. Question 8. A patient's ECG shows a heart rate of 40 bpm with wide QRS complexes and no association between P waves and QRS complexes. This rhythm is Option A. Sinus bradycardia. Option B. Atrial fibrillation. Option C. Third-degree AV block. Option D. Ventricular escape rhythm. The correct answer is option C. Third-degree AV block. Third-degree, complete, AV block is characterized by complete dissociation between atrial and ventricular activity. The atrial rate is usually faster, P waves, than the ventricular rate, wide QRS escape rhythm. This is unstable and may require transcutaneous pacing or atropine, though atropine is less effective for infranodal blocks. Question 9. A patient's blood pressure is 200/120 mmHg with headache, confusion, and nausea. The CEN should recognize this as Option A. Essential hypertension. Option B. Hypertensive urgency. Option C. Hypertensive emergency with end organ damage. Option D. Pseudohypertension. The correct answer is option C. Hypertensive emergency with end organ damage. Hypertensive emergency is defined as severely elevated blood pressure, 180/120 mmHg, with evidence of acute end organ damage, neurological symptoms, renal impairment, cardiac ischemia, or retinal changes. Hypertensive urgency has elevated BP without end organ damage. This patient's neurologic symptoms indicate end organ damage, requiring immediate 4 antihypertensive therapy, e.g., labetalol, nicardipine, with gradual BP reduction. Question 10. A patient presents with testicular pain, dysuria, and a fever. The testicle is tender. Which diagnosis is most likely? Option A. Testicular torsion. Option B. Epididymitis. Option C. Orchitis. Option D. Hydrocele. The correct answer is option B. Epididymitis. Epididymitis is inflammation of the epididymis, often due to infection, UTI, ST. It presents with gradual onset of testicular pain, swelling, tenderness, fever, and sometimes dysuria. It is differentiated from torsion by gradual onset, versus sudden, and presence of fever. Doppler ultrasound shows increased blood flow in epididymitis, versus decreased in torsion. Treatment includes antibiotics and NSAIDs. Question 11. A patient with suspected measles should be placed on which type of precautions? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions. The correct answer is option A. Airborne precautions. Measles is highly contagious and transmitted via airborne particles. Patients with suspected measles should be placed on airborne precautions in an AIIR with negative pressure. Staff should wear an N95 respirator. Droplet precautions are for influenza, pertussis, and meningitis. Contact precautions are for MRSA, VRE, and C. diff. Measles requires airborne isolation. Question 12. A patient with alcohol withdrawal presents with tremors, hypertension, tachycardia, and diaphoresis. The CEN should anticipate. Option A, benzodiazepines, lorazepam, chlordiazepoxide. Option B, antipsychotics. Option C, beta blockers. Option D, 4 fluids only. The correct answer is option A. Benzodiazepines, lorazepam, chlordiazepoxide. Benzodiazepines are the first-line treatment for alcohol withdrawal, reducing the risk of seizures and delirium tremens, DTs. They work by augmenting GABA, thus preventing sympathetic overdrive. Chlordiazepoxide, Librium, and lorazepam, Ativan, are commonly used. DTs are a medical emergency requiring ICU-level care. Antipsychotics and beta blockers are adjuncts or alternatives but not first-line. Question 13. A patient is suspected of being a victim of human trafficking. The CEN should. Option A, notify security and social work. Option B, notify law enforcement. Option C, provide a private space for assessment. Option D, all of the above. The correct answer is option D, all of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential. Question 14. A patient with a chemical burn to the skin should have the skin. Option A, neutralized with an acid or base. Option B, decontaminated with water. Option C, covered with a sterile dressing. Option D, treated with a topical antibiotic. The correct answer is option B, decontaminated with water. Chemical burns require immediate decontamination with water, irrigation, for at least 15 to 20 minutes. Neutralization is not recommended because it can cause exothermic reactions, heat, or further tissue damage. The CEN should remove contaminated clothing and irrigate the skin thoroughly. This may be done before the patient arrives in the ED, pre-hospital. Question 15. A patient presents with a sudden onset of a severe headache, nuchal rigidity, and photophobia. The CEN should suspect. Option A, meningitis. Option B, subarachnoid hemorrhage. Option C, migraine. Option D, both A and B. The correct answer is option D, both A and B. Meningitis and subarachnoid hemorrhage share classic signs: severe headache, nuchal rigidity, and photophobia. The differentiation is made with imaging, CT for SAH, and lumbar puncture, LP for meningitis. Treatment for both is emergent. A non-contrast CT head is often the first test for SAH, LP is used for meningitis and if CT is negative for SAH. Question 16. A patient with a pulmonary embolus is receiving heparin. The CEN should monitor for which complication? Option A, bleeding. Option B, heparin-induced thrombocytopenia, HIT. Option C, allergic reaction. Option D, all of the above. The correct answer is option D, all of the above. Heparin has multiple complications: bleeding, due to anticoagulation, HIT, immune-mediated thrombocytopenia, and allergic reactions. Monitoring includes APTT, for therapeutic effect, platelet count, for HIT, and bleeding assessments. HIT should be suspected if the platelet count drops significantly. Alternatives include direct thrombin inhibitors, argatroban, if HIT occurs. Question 17. Which law requires screening and stabilization of patients in the ED, regardless of ability to pay? Option A HIPAA. Option B EMTALA. Option C OSHA. Option D ACA. The correct answer is option B, EMTALA. The Emergency Medical Treatment and Labor Act, EMTALA, requires that anyone coming to an ED must be screened and stabilized, regardless of their ability to pay. This applies to all hospitals that participate in Medicare. Patients cannot be transferred without being stabilized, unless medically indicated. EMTALA ensures access to emergency care for all. Question 18. A patient with Guillain-Barré syndrome is admitted with rapidly progressing weakness. The CEN should monitor for: Option A hyperthermia. Option B respiratory failure. Option C hypertension. Option D tachycardia. The correct answer is option B, respiratory failure. Guillain-Barré syndrome is an acute demyelinating polyneuropathy that causes ascending weakness. The most serious complication is respiratory failure due to respiratory muscle weakness, diaphragm and intercostals. CENs should monitor vital capacity, negative inspiratory force, NIF, and tidal volume. Intubation may be necessary if vital capacity drops, 15 ml/kg, or NIF decreases, -20 cm H2O. Question 19. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as: Option A mild exacerbation. Option B moderate exacerbation. Option C severe exacerbation. Option D life-threatening asthma with impending respiratory failure. The correct answer is option C, severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 20. Which medication is indicated for status epilepticus as a first-line agent? Option A lorazepam, Ativan, 4 mg 4. Option B phosphonatoin 20 mg/kg 4. Option C levetiracetam, Keppra, 1 gram 4. Option D valproic acid 20 mg/kg 4. The correct answer is option A, lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include phosphonatoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 21. A patient presents with a near-drowning event. The CEN should be aware of which complication? Option A aspiration pneumonia. Option B pulmonary edema. Option C hypoxia. Option D, all of the above. The correct answer is option D, all of the above. Near drowning can lead to aspiration pneumonia, pulmonary edema, and severe hypoxia, which may progress to ARDS. The priority is airway management, oxygen, and treating any underlying causes, e.g., cervical spine injury. The patient should be monitored for respiratory distress, electrolyte abnormalities, and neurologic injury. All of these complications are possible and require monitoring. Question 22. What is the primary mechanism of injury in a patient with a flail chest? Option A, penetrating trauma to the chest. Option B, blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Option C, sudden deceleration injury. Option D, compression injury causing rupture of the diaphragm. The correct answer is option B. Blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely mobile segment. This paradoxical movement impairs ventilation and may lead to respiratory failure. The underlying pulmonary contusion is often the main cause of hypoxia. Treatment includes pain control, oxygen, and possible mechanical ventilation. Question 23. A patient with testicular pain, nausea, and vomiting has a tender, swollen testicle that is elevated. Which diagnosis is most likely? Option A, epididymitis. Option B, testicular torsion. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Testicular torsion. Testicular torsion is a time-critical emergency requiring prompt surgical intervention to salvage the testicle. It presents with sudden, severe testicular pain, nausea, vomiting, and an elevated, tender testicle. Doppler ultrasound is the diagnostic test, though surgery may be indicated without imaging if suspicion is high. Torsion is a surgical emergency. The window for salvage is typically 4 to 6 hours. Question 24. Which of the following is a classic finding in a patient with pericarditis? Option A, ST segment elevation in all leads. Option B, PR segment depression. Option C, chest pain that worsens with inspiration. Option D, all of the above. The correct answer is option D, all of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 25. A patient is in respiratory distress with a heart rate of 120, respiratory rate of 36, and SpO2 of 85% on 4L/min nasal cannula. The patient is anxious and unable to speak in full sentences. What is the appropriate next step? Option A, increase oxygen to 15 L/min via non-rebreather mask. Option B, intubate immediately. Option C, apply BiPAP. Option D, administer bronchodilators. The correct answer is option A. Increase oxygen to 15 L/min via non-rebreather mask. This patient is in respiratory distress with hypoxia, SpO2 90%. The first step is to maximize oxygen delivery with a high-flow non-rebreather mask, 15 L/min. If the patient does not improve, non-invasive ventilation, BiPAP, or intubation may be needed. Bronchodilators are appropriate for bronchospasm but not the primary intervention in all cases. Intubation is considered if the patient fails non-invasive measures.